Ohio reporting close to 12,000 new coronavirus cases today as the situation in the state's hospitals is getting increasingly worse. The Cleveland Clinic confirming to NBC News that nearly 1,000, that's right, 1,000 of its caregivers are out right now because of COVID. NBC News reporter Valerie Castro is joining us now from outside the Cleveland Clinic. Valerie, that is a huge number. How is the Cleveland Clinic handling such a hit to its staff?
Well, Allison, it is important to note that nearly 1,000 number, that is a mix of workers who are both sick with coronavirus and also those who have had to quarantine after facing exposure. They may not necessarily be sick, but were exposed and have to undergo that 2-week period. And of course, that's a long stretch for them to be out. They say it's scary. We talked to workers this morning who say they are feeling anxious. We spoke to a critical care transport nurse earlier. He sees patients when they are in really bad shape, when they are in serious condition, at the point that they have to be flown here to the Cleveland Clinic for a higher level of care. And he says hearing about colleagues getting sick is very scary. Take a listen to what he had to say.
It's a little tough because, before you would go to work and you would see some patients here and there before the pandemic that you went home and had a thought in your head that you were a little worried about bringing some home to your family, so you take a little extra precautions. But now it's every day. You go home and you just have that constant worry in the back of your head that you're going to inadvertently bring something home to your family. So, you go home, you take extra steps. You basically just take your uniform, put it in the washing machine right away, take a shower right away, and your family just has to understand that you have to keep your distance.
When you take an already stressful job and now you're seeing patients at their worst, and then you hear that your colleagues are also getting sick, it just adds to that anxiety. Allison?
Oh, Valerie, it's just a terrible situation. Let me ask you, is this the case in other hospitals around the state, or is this primarily an issue there in Cleveland?
No, this is certainly a problem around the state. And actually, the Ohio Hospital Association says that 20% of healthcare facilities throughout the state are now reporting staffing shortages. So it is not just limited to Cleveland Clinic. It is something that is happening around the state. The governor noted that cases are going up in all 88 counties, so no one can be spared. It's not as though one hospital can borrow staff from another to help them. Everyone needs their staff at this point.
Governor Mike DeWine introduced stricter mask mandates and regulations last week. Could you tell us more about them? And does it look like they could be enough to help get COVID under control there with Thanksgiving just days away, or are people concerned that these measures are falling short?
Allison, there has been some debate. The governor instituted a curfew starting on Thursday. Non-essential businesses must be closed from 10 p.m. to 5 a.m. until December 9th, and residents are encouraged to stay in their homes during those hours, only leave for essential needs. There was some debate this weekend. There was actually a small rally that was held, people protesting it, not wearing masks, saying that it just doesn't make sense. Why would the virus stop between the hours of 10 p.m. and 5 a.m.? So it remains to be seen if that will be effective. Allison?
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.